I think having accessible healthcare environments is just as fundamental as any other part of providing a person-centred, fit-for-purpose healthcare service. We know that we have increasing numbers of people in Wales with sensory loss, and some of that is as a result of things like diabetes, causing problems with eyesight, and that's happening in younger and younger groups. So it's a prominent part of our patient group. And it should be a fundamental part of how we run health services. We take it for granted when we're in and out of hospitals as professionals, and we're in and out of GP surgeries and nursing homes, and we almost are blinkered to the environment that we walk through. But if you're someone who's got a hearing difficulty or some visual impairment, just the thought of going into a healthcare environment and you don't know how you're going to be able to find your way around that building, as well as being quite traumatised because you're not sure what you're going to hear when you meet with that professional. So how we design environments to make them as user-friendly as possible to help people find their way through what is a very difficult circumstance in the first instance, and how we make sure that within our current environment we make the best use of environment, walls, stairs, hazards that actually could create more harm, like slips, trips and falls, as well as making the most of new builds, just to design out any risk and to build in confidence for people with sensory loss. I think it's absolutely fundamental for us. I think accessible healthcare environments are just a fundamental aspect of prudent healthcare. As I mentioned earlier, it should be a core part of how we run health services, and from the concept of designing an environment and designing communication to best meet the needs of different people in society. We have to do that with people. We will never understand the best way to communicate the needs that people have in a way that they live with on a daily basis without co-designing that, co-producing, be it an information leaflet, be it an audio guide around some part of the services that we provide, be it the design of an internal environment. So I think at the heart of this is actually co-producing a much more fit-for-purpose healthcare setting and healthcare information. We in Public Health Wales run screening services. We continually learn from people with sensory loss who are feeding back to shape the way that we run those services, and even communicate with people for booked appointments, because we do make assumptions. So walking in the shoes of those who are experiencing and living with sensory loss is fundamental. So I think the first and foremost for me is prudent healthcare contributing to co-producing services, design, information for people with sensory loss. The other thing for me is we know that people with sensory loss can be less likely to access healthcare services because of confidence of the environment, the safety for them, and that makes them perhaps less or more reluctant to access healthcare when they need to. We know that can affect their health and well-being, and that can result in perhaps an escalated condition becoming more serious, and putting them into a higher risk situation than if they had the confidence and felt able to access those services earlier on because of lack of confidence in that environment. So making sure that people have the right services at the right time, again, is a fundamental aspect for prudent healthcare, and providing people with the information that they need, using the methods and means that best suit their sensory loss, has to be an absolutely key part of how people can make decisions with healthcare practitioners. So I think prudent healthcare in its own right contributes and should contribute to this agenda.